Today I'll be giving a brief overview of cervical cancer, specifically its causes and prevention. So here's a diagram of the female reproductive system, and I want you to focus on the region called the cervix over here, specifically the endocervix, the inner lining of the cervix, and the ectocervix, the outer lining of the cervix. Now if we take a more blown up view of the cervix, you'll notice that the endocervix is lined by columnar epithelium, while the ectocervix is lined by squamous epithelium. Now the junction in between these two types of epithelia is called the squamo-columnar junction, which is an important area we'll be returning to in the next slide. Now while this diagram shows the junction between these two types of epithelia nice and clear, the reality is that it is not that simple. Here's the squamo-columnar junction that we talked about, and as you can see, this diagram is rather different from the previous one that we've seen. What's happening is that the columnar cells of the endocervix are constantly changing into the more squamous cells of the ectocervix. The zone in which this occurs is called the transformation zone, and the process of normal change is called metaplasia. In this case, these are metaplastic squamous epithelium. Now bear in mind this is usually a normal process, but it can go abnormal at times. Here's a different view of the transformation zone over here. And these are columnar cells, while these are the columnar cells that have changed to squamous cells, lined in a different shade of red. It is important to bear in mind that while the change from columnar cells to squamous cells is usually a normal process, it can go abnormal at times. And when this abnormal change is severe, it can lead to cancer, or in this case, cervical cancer. Especially when cells are infected by a virus called human papillomavirus virus HPV, specifically types 16 and 18, this abnormal change can be accelerated, leading to cervical cancer. HPV types 16 and 18 cause the vast majority of cervical cancers, around 70% of them. HPV types 16 and 18 are transmitted by sexual contact. Now, HPV type 16 and 18 infection can be prevented by an effective vaccine. In 2007, Gardasil 9 has been developed, which prevents against HPV type 16 and 18 as well as other types of HPV. Cervical cancer can also be prevented through effective cervical cancer screening programs, and the method of doing so has been recently changed to HPV DNA PCR testing, which basically takes an endocervical swab to the lab for PCR analysis, which detects HPV, which is a more accurate and effective method. An important point to take away from this is that those vaccinated must still also be screened. And the reason is that not all HPV types are vaccinated for, and other types of HPV can also cause cervical cancer. Thank you for listening, and I hope you found this video